I'm Varshit. So I'm the founder of BlockMMP. So this was a project which started in 2019, and my background has been in computer engineering and data science space. And this actually came out of a hackathon in 2019. So before I actually dive into BlockMMP, I just want to give a brief overview of the opioid epidemic in the United States. So these are some of the figures which were given out by the United States Department of Health and Human Services. And as you can see, these numbers are pretty shocking. And as of 2020, 1.6 million people suffered from opioid use disorder. And these are people who are not just using illicit opioids, but people who had to be treated with opioids for maybe pain medication or after undergoing like a traumatic surgery. But then they developed a dependence on the opioids. So this is a pretty large issue, and the UN has also kind of recognized it. So basically, the opioid administration space, or the prescription medication administration space to treat patients with opioid use disorder, is mismanaged. So let me walk you through what happens through this small animation when a patient who is actually prescribed with medication to help with their opioid use disorder. So they are supposed to go to a clinical site, and one of these clinical sites are being assigned to this patient, and they have dispatch nurses at each of these clinical sites. And so when the medication is requested by this clinical site, in most cases they don't have the proper dosage, so they actually try to redirect them to a different clinical site. And this involves a tedious communication protocol involving arcane methods like fax or telephone. And at the end of the day, what happens is if they don't respond in time, the patient undergoes like severe withdrawal symptoms. As a result, the patients leave against medical advice. So they don't get the medical care at all. And Health Injustice Action Lab actually notified that more than 50% of patients reported having a negative interaction with this system through PDMP, which is the state mandated prescription drug monitoring protocol, which actually designed this system. And more than 50% of patients reported having a negative interaction. And upon that, there is also a lot of stigma associated with patients who suffer from opioid use disorders, just for the sake that they are being under these prescription medications. And due to a lack of security in this system, law enforcement or outside external organizations can actually surveil which of these patients are on these medications. So this is clearly a flawed system, and this is just making the opioid epidemic a far worse problem. So what are we doing? So again, to kind of summarize the problem statement, due to the mismanaged system, there's inaccurate dosage information across all clinical sites. And there are logistical limitations where the patients don't get the dosage that they require because the clinical sites do not communicate with each other, and the information is only existing at one of these clinical sites, which causes a decreased trust in the healthcare system for these patients. So what is BlockMMP? So BlockMMP offers a platform which is powered by Hyperledger's Hyperledger framework developed by IBM. It's a permissioned blockchain framework to provide a very streamlined approach to tracking prescription dosage histories of medications used to treat patients with opioid use disorders. So we offer better patient privacy, easy integration process, and we are also in the process of getting our patent. And so we actually developed this platform in collaboration with our research partners, and we were able to get an NIH grant through the National Institute of General Medical Sciences in the US. And so this ensured that we had constant feedback of like what was like some of the core issues in the prescription administration system. So basically, our objective with this platform is to ensure that it saves time for the hospitals, the clinical sites, and the patients to get their dosage when they need it, to get the prescriptions when they need it, and then also proper coordination. So we offer a system which dramatically decreases the administrative costs, and at the same time make sure that like there's always a continuity of care for these patients. And our product, as I mentioned, offers a very simple web interface for all of the parties involved, be it the prescriber, the dispatchers, and then the patient. So it makes it so much more easier for the relevant users of the system compared to the prescription drug monitoring program, which is the current platform which is offered. And our main value proposition is that we offer an easy to use SLA and service offering, and it is much more easier than conventional EHR systems, for example. An EHR deployment requires a lot of infrastructure maintenance and liability on the part of the hospitals, but our basically our service offering is very simple, and you can just have your system deployed within 24 hours. And at the same time, we offer digital contract validations through our blockchain platform. And we also plan to utilize zero knowledge protocol to ensure complete anonymity for these patients who are actually being treated for opioid use disorders. So this provides more trust and privacy for the patient as well. So just to kind of like give an idea of the market opportunity that we have. So as you can see, the number of opioid treatment program facilities in the US was almost 1,300 up to 2015, and it has only increased since that point. So there are a lot of hospitals in the United States which actually use opioid treatment programs through these hospitals, and all of them have their own PDMP in each state. And these are just some of the numbers on the number of methadone treatment clients in the US, and it has just increased over time up until 2019, and again, like after 2019, it continues to increase. And the opioid use disorder market by size by drug, which is 3 drugs which are actually used to treat patients with opioid use disorder. So as you can see, like at 2016, the total market was 1.3 billion, and it is projected to actually increase almost threefold by 2026. So there's a really large market for these drugs, and these are the only effective treatment pathways which are feasible for patients with opioid use disorders. And so we are targeting methadone as of now, but this is just a view of the market share. So we target methadone starting with our first hospital, but methadone, buprenorphine, and naltrexone are the 3 main opioid use medication. And so this is just, again, a forecast, like a global forecast of the market size in terms of the opioid agonist drugs, which are, again, drugs like methadone, buprenorphine, but also other drugs which are used as pain medication. But so this again is a huge market which almost sums up to 25 billion by 2024 as per forecast. So just to give an idea of like what existing solutions are present, as I mentioned, there's obviously PDMP, which is just like government maintained and funded, which is extremely inefficient because over 50% of patients don't trust the existing system, and also they have like very arcane and non-digitized processes where you have to actually communicate with the clinical sites through either phone or fax, which is really slow and cumbersome. And you have other solutions like Factum. So, so companies like Factum, they offer just a very abstract blockchain platform for healthcare use cases. And so we provide something which is much more niche and specialized while we develop that in partnership with people in academia and industry. So Burst IQ is another such platform, which again is very abstract, and they also do analytics. And basically, Burst IQ could be seen as someone that we could use as a service provider. But from a competitive landscape perspective, we are very niche in what we are offering, and then we have the expertise to back the niche systems that we are building. So in terms of our projections, so we have the alpha phase that we deployed with 2 hospitals in Rhode Island, Providence. So this was Victa and then Kodak. Both of these hospitals are part of the opioid treatment program in Rhode Island. And some of the other hospitals that we are actually targeting early 2023 are Butler Hospital, Boswell, and the Journey to Hope Health and Healing Providence. So our estimated revenue is approximately 300,000 USD with 15 hospitals in 2023. And yeah, so based on like how many hospitals we can onboard, it can go up to like 400,000 USD. And we offer a SaaS offering, and then we charge an annual subscription with these hospitals. And then as per the SaaS offering, if the rate limit is exceeded, we charge per request. So these are our current partners. Victa was one of our hospitals, like the first hospital which used the alpha phase of the platform, and they were also quite involved in actually developing the platform itself. And then COBR is basically Centers of Biomedical Research Excellence. They helped us with technology transfer in terms of moving the research component of the platform into the market. And these are some of our additional partners. So like Seth Clark is one of the prescribers who prescribes opioid use disorder medication like buprenorphine to patients. So he's one of the people who would be in our advisory board. And Tracy Green is also a professor and director of the Opioid Policy Research Collaborative, who deals with the policy initiatives in terms of drug administration in the opioid use disorder space. And then we also have technology partners through HP Zerto, and they are our computing infrastructure partner as of now. Cool. Thank you all for listening to my pitch. I would be open for any questions, or also happy to have a conversation in the networking session.
Thank you, Vayesh.